Thanks everyone for coming. I'm Seda Tabassum, a PhD student at Boston University. I work with Dr. Darren Rublier at the Biomedical Optical Technologies Lab. Today my talk is about longitudinal and long-term monitoring of chemo response in mice using spatial frequency domain imaging and how we improve the SFDI data accuracy by introducing a two-layer approach in the inverse model. So longitudinal monitoring of chemo is an unmet need in healthcare right now, and diffuse optical imaging tools, in short DOI, have shown some success in filling in the gap. The technique uses near-infrared light to image tissue optical properties, and from there provide important hemodynamic information including oxy-deoxyhemoglobin concentration, total hemoglobin, and oxygen saturation. So they have a better safety profile and are relatively inexpensive compared to current standard of care imaging modalities such as MRI and PET scan. Here you can see diffuse optical spectroscopic imaging, in short DOSI, which is a clinical DOI tool taking point scan on a hand. This point measurement can then be interpolated to generate an image. Here is total hemoglobin from a healthy breast measured with DOSI superimposed on a 3D scanned bus model. DOSI has already shown that it can predict treatment response in breast cancer patients in the clinic. However, preclinical setting offers a great way to validate this clinical outcome because it provides better access to the treatment regimens and measurement time points throughout the longitudinal studies. And also it's easier to store tissue samples, which are very important for correlative analysis. SFDI is a diffuse optical imaging tool which is suitable for preclinical imaging, and it provides similar optical information at a shallower depth. Here you can see SFDI measuring mouse, and here SFDI is showing oxygen saturation in a mouse tumor, which increases significantly after treatment. And there is always this advantage of translating the preclinical findings to the clinic for a better clinical outcome. So a lab has recently showed that SFDI is feasible to longitudinally monitor subcutaneous tumor in mice. Here is an example of scattering data along with tumor volume from a single representative tumor. The vertical lines here indicate days of anti-angiogenic DC-101 treatment. You can see that the scattering changes drastically over the entire 45 days of study. And there are times when the change in scattering precedes the anatomic change in tumor volume, which can be an earlier prediction of treatment response, but need to be validated with additional studies. So this presents the potential of SFDI for earlier detection of treatment response, and at the same time explore molecular and physiological correlates of optical changes observed with the diffuse optical tools, and find optical markers which are predictive of treatment response or resistance. And most importantly, the knowledge learned from the preclinical setting can be translated to the clinic, ultimately contributing to earlier detection of treatment response in patients, and also possibly help guide combination therapy with diffuse optical tools in future. To quickly go over SFDI here, fringes of light at multiple wavelength and spatial frequency are projected on an object as shown in the video here, and the reflected images is collected by a camera. The intensity images looks like this as shown in the top row here. The intensity images are then demodulated and calibrated to extract diffuse reflectance, which is a function of spatial frequency. So RD value in at least two different spatial frequency is then input to a two-frequency lookup table to extract optical property. The lookup table shown here has DCRD in its y-axis and ACRD in its x-axis. The horizontal line represents different absorption property, and the vertical lines represent different scattering property. So the absorption information can then be used to extract optical property, used to extract hemodynamics, including oxy-deoxyhemoglobin concentration and oxygen saturation, as I already mentioned. On the other hand, scattering provides knowledge and cell and organelle density and extracellular matrix. Since SFDI has a penetration depth on the scale of millimeter, we focus on subcutaneous tumor in SCID mouse, and we consider tumor as a semi-infinite homogeneous medium with varied optical property. And to model the tissue, we use a single Monte Carlo technique provided by Martinelli et al., where they simulate RD in spatial domain and then use Hankel transform to convert RD to spatial frequency domain. They also scale RD for all optical property from a single Monte Carlo simulation. That's where the name comes from. However, the conversion of RD and also the scaling in μs prime introduce errors. The technique fails to mimic subcutaneous physiology because it does not account for the skin layer on top of the tumor layer. And most importantly, it's inapplicable to layered medium. To overcome the limitation, we moved toward a two-layer approach to generate a two-layer lookup table, where the top layer is the skin layer with fixed μA, μs prime, and thickness, and the bottom layer is the semi-infinite tumor layer. The way this two-layer lookup table works is that it receives RD, takes into account of the skin layer effect, and then provide optical property only for the bottom layer. And we used a method provided by Gardner et al. To model the tissue. Most importantly, because it is applicable for layered mediums such as this, it simulates RD in spatial frequency domain by taking into account of complex photon weight. One simulation yields RD for all spatial frequency that you're interested in, and it's also possible to scale μA using Beer's law from a stored photon trajectory. To perform the simulation, we collaborated with Dr. Venugopalan and Dr. Carol Hayakawa from Beckman Laser Institute at UCI, and we performed all the simulation in Boston University shared computer cluster facility. So I generated two lookup tables using Gardner method, one for the homogeneous and one for two-layer. For all layers, the G and N value were kept same to mimic human tissue. The range of optical property for the tumor layer only were selected to make sure it covers the tumor values. And for the skin layer, for the case of the two-layer lookup table, I took optical property from Sabino et al., where they presented optical property from dorsal skin in bulb C mouse using Kubulka-Monk photon transport theory. And for the thickness, I measured 8 excised tumor skin using caliper from black mouse and used their average in the actual simulation. The H&E image shows here cross-section view of a representative tumor skin with a thickness of 450 micrometer. And for the same skin, I got caliper measurement of 400 micrometer, which confirms that the caliper measurement were very close to actual skin thicknesses. So for each lookup table, 192 separate Monte Carlo simulations were performed, one for each scattering value, and all of them had the same value to do μA scaling later. Each Monte Carlo simulation requires two CPU to run in parallel, and the runtime of the simulation was dependent on optical properties with a maximum of 4 days. And after that, post-process was done to scale for all μA values, and the post-process runtime was between 2 to 3 days. So the figure here shows diffuse reflectance RD data as a function of spatial frequency using 3 different lookup tables for a range of optical property. Because the marginally homogeneous lookup table is the one that was previously used in our lab, and the Gardner method ones are the newly generated lookup tables at the BU shared cluster. You can see that there is only limited difference between the marginally homogeneous and Gardner homogeneous. However, there is significant difference between Gardner homogeneous and Gardner two-layer due to the incorporation of the skin layer. To better show the difference between the Gardner homogeneous and Gardner two-layer lookup table, I started with a range of RD value for AC and DC optical property. I extracted optical property using both lookup table and then plotted the percent difference with respect to Gardner homogeneous for μA and μs prime. You can see that the percent difference is significant in both optical properties for all combination of RD values. And at high RD values, the μA value is low, which in turn raises the percent difference. To answer the question if the two-layer lookup table does improve optical property accuracy in the tumor layer, I conducted a phantom experiment where I made 4 different two-layer lookup tables and all with the same top layer. So the optical property pair for the tumor layer are representative of 4 sections of the lookup table, and I termed them as tumor 1, 2, 3, 4 just because they represent tumor layer. And for the top layer, I made a 310 micrometer thick silicon layer out of a 330 micrometer thick aluminum well with the size of 1 inch by 1 inch. So the optical mu A of this thin layer is within 4% of true skin layer mu A, and the mu S prime is within 0.3% of true skin layer mu S prime. And to know the true optical properties of both layers, I use the Gardner homogeneous lookup table. So I measure the phantoms with SFDI, extract optical property using both lookup table, and then try to find out the answer that which lookup table provide a better approximation of the true optical property in the tumor layer. So on the left you have mu A error in the tumor layer, on the right you have mu S prime error for all tumors. The error is defined as measured optical property minus true optical property. The error for Gardner 2 layer is always less than Gardner homogeneous for all cases, and for some cases the values are so low that it doesn't show up in the figure here. The Gardner 2 layer reduces error by between 7 to 300 times in mu A and 1 to 23 times in mu S prime. So this proves that the 2-layer lookup table does improve accuracy of tumor layer optical property over the homogeneous lookup table. Now that we know that the 2-layer lookup table works, we wanted to answer the question that if I measure a 2-layer tissue for which the top layer optical property and thickness do not match with the actual mu S prime D used in the modulation, how this mismatch in the skin layer features do affect the optical property in the tumor layer. To do that, I conducted a number of simulations on 2-layer medium. The optical property pair for the tumor layer, again, are representative of 4 sections in the lookup table and termed as tumor 1, 2, 4. And for the skin layer, what I did is that varied the skin layer features by a percentage of the actual value used in the model. So I found that for all cases, the error for the 2-layer was less than error for the Gardner homogeneous lookup table, which confirms that the Gardner 2-layer is less sensitive to such skin layer mismatch than the Gardner homogeneous. Here is an example of mu A error in the tumor layer for mismatch in skin layer thickness. In this case, all features in the skin layer were kept same as in the model, except the thickness, which was changed between minus 40% to 80% of the actual values in the model. You can see that the error in the mu A reduces as the thickness mismatch reduces. This figure tells you that if you measure a 2-layer tissue for which the top layer is 40% thicker than the actual thickness used in the model, then you may expect a 0.002 inverse millimeter deviation in the tumor layer mu A. And if you happen to use the Gardner homogeneous lookup table to extract the optical property, the error raises by more than 3 times. So just to reiterate that the Gardner, even when we are wrong in the assumption of the skin layer features, the Gardner 2-layer does a better job in providing optical property for the tumor layer than the homogeneous by a long margin. In the end, I applied the lookup tables to large scale to longitudinal mouse data. Here is scattering data from a single representative tumor receiving anti-angiogenic DC-11 treatment every 3 days. You can see that over the entire study, the 2-layer lookup table does increase the scattering value, which in turn increases the contrast between the pre- and post-treatment time point. Here is color map of scattering data at day 0 and day 30, which is a pre- and post-treatment time point for homogeneous and for 2-layer lookup table. And you can see that the increase in scattering is consistent over the entire tumor ROI. And here is longitudinal data from a representative prostate tumor receiving metronomic cyclophosphamide treatment every 3 days. And you can see that over the entire study, the 2-layer lookup table decreased the oxygen saturation value, meaning that we can now better measure tumor hypoxia with the 2-layer lookup table, which was previously obscured by the homogeneous lookup table. The figure on the right shows color map of oxygen saturation at 2 different days for homogeneous and 2-layer. Again, the decrease in oxygen saturation was consistent over the entire tumor ROI. Currently, I'm working on applying the 2-layer lookup table on a large-scale mouse data, and perform histological correlative analysis in parallel to answer important biological questions. With that, I would like to end and thank my advisor, Dr. Darren Roblier and David Waxman, to help with the mouse studies. I also want to thank Dr. Venugopalan and Hayakawa from Beckman Laser Institute to help us with the Monte Carlo simulation. I'd also like to thank Dr. Malden and Gage from University of Arkansas to help us with making the tumor layer optical properties. And thank my fellow lab mates and funding sources. Thank you very much.